This report paints a very stark picture that the health impacts of climate change are worsening across most indicators. Can you walk us through what the data is telling us and where we stand right now on all this and what's changed in recent years?
Yeah, thank you so much, Nick, for having me here. And as you said, the latest report of the LancetCountdown, which I should say is a huge effort from 128 leading researchers from around the world, from across disciplines, has perhaps the most concerning and sobering findings of the 9 years of reporting that we've had. We see that across 65% of the indicators, each of them tracking an aspect of the link between health and climate change and the risk of climate change to our health. 65% of those have reached a record new level of threats in the latest year of data. We had a similar finding the year before, which means that year after year, we keep on breaking records to people's, on the threats to people's health, to people's lives.
Unfortunately, air pollution overtook tobacco as the leading external threat to health last year. And it's causing about 8 million deaths every single year, which is a huge fraction of the deaths globally. It also affects people's quality of life when they're suffering from the diseases that are either caused by or exacerbated by air pollution. I think some of the ones that we think about the most when we're thinking it, because we're breathing it in, are the respiratory conditions. So asthma, lung cancer, COPD, but it affects every single organ of our body.
It's not just that we won't have any health if we let the climate go. It's that the actual solutions to climate address health. That was an incredible mistake in my mind and him in the public discourse. We need to counter that and really get back to the simple, clear truth that the climate solutions are going to be better economically, better for our health, better for development, as well as for climate.
We are now looking at air pollution becoming systemic rise rather a seasonal occurrence in India, unfortunately, to a point where doctors are prescribing and advising citizens and residents of Delhi leave the city for about 3 to 4 weeks in this season so that they can save up on about 5 to 10 years of their lives. The situation is extremely bad. And there's evidence for the fact that you are now looking at the National Clean Air Program, which is the Government of India policy on clean air. The funds under which are underutilized. So last year we had about 68% of the $1.3 million that was disbursed only used. And also of the 68% that was being used, 67% of that was being used on road transport, which is essentially dust.